My name is Frankie Lazarus. I had spinal surgery August of last year.
I'm Caroline, and this is my assistant's dog in training, Sarah. About 2 years ago, took her for a walk, and she was thrown a ball, caught it, came down, landed on one back leg, and crumpled in a heap.
Basically, I was in absolute agony. I think originally it started from a fall where I landed on my coccyx. I was sent for a scan and found that I had this problem with the discs in my back.
I'd tried steroid injections on her. I'd tried hydrotherapy. I'd tried laser therapy. Without a doubt, she was much, much better. She wasn't fixed.
I had to have 2 rods going up the side of my spine and a clamp going through the side. Very reluctantly had the operation because I was terrified. But look at me, I can walk, I'm just back to normal. It's just incredible.
8 months now since the surgery, and she is still every single day improving neurologically. For the first 7 weeks, she didn't wag her tail. It was completely paralysed. To go from that to what she's doing now is incredible. It sounds very silly when I say this, but she is the centre of my universe, and she makes the difference for me sometimes, whether I get out of bed in the morning or not. It just makes it all worthwhile.
So this is your actual surgical report. Correction of degenerative scoliosis and L3-4 spondylolisthesis, L3-4 lateral interbody fusion with extension fusion, L3 to S1 and bilateral L3-4 decompression. Wowzers.
Big?
Wowzers. That's
a
a big deal. Yeah. Sarah's condition, Caroline, when did that emerge? How many months before you saw me?
At least 18 months, if not 2 years.
Sarah's situation was that she had a big disc problem, which was bulging in her lower back. Now, dogs have 7 lumbar vertebrae.
How many do humans?
5.
5, right.
So she has a very similar technology within her as you have in your spine. And the thing about that is that the similarities between your condition is almost identical.
Yeah.
The implants are almost identical. She has a spacer in her back, she has 2 rods in her back and multiple screws. You have a spacer in your back, you have 2 rods and multiple screws. But the main thing that people forget is to give you the implants you have, hundreds of animals were killed to give you those implants. And it's a difficult thing to take on board, isn't it? But that's the reality. And the reality is right now across the world that in order to get safe, effective treatments for human beings, animals have to lose their lives because it's the only way to get new implant systems. There may be a better way to get that safe drug and implant into you, or a better way to get that safe drug and implant into Sarah. And if we work together, we would have safer implants and safer drugs.
The collaboration between human medicine and animal medicine is surely a no-brainer. I just cannot understand why it's not been thought of before and why it's not been worked on before. Why create a situation where animals have to die needlessly when they're animals suffering from the same conditions who could actually be helped? Maybe it's seen as experimental, but if the difference is that animal either being in pain or losing its life or having some experimental surgery which might just help, why wouldn't you?
We can now plot her future using CT scans, which were not available 30 years ago, 40 years ago, 50 years ago. So we now have the technology to look inside a dog without having to kill the dog, to tell what happens as a result of an intervention. And for the first time in the evolution of mankind, that's possible. And therefore it requires us to look again at what it is that we do. There's no need to recreate the wheel if the wheel is already created. When Sarah's mum comes to see me, Caroline asked the question, what can you do? And I remember vividly the conversation. The conversation was, What are the risks? Is this really necessary? And then I'm going to make a decision whether my friend's life is going to continue to be miserable, or am I going to accept those risks and move forward? But we can minimize those risks by working together. We can minimize implant failure by working together. We can maximize the knowledge gained from your operation and from the dog's operation by working together. And with the Humanimal Trust charity, the objective is to provide treatment for humans and animals at the same time at the coalface, but without losing the life of the animal. And that's, as I said, only become recently possible, but we need to make people aware that the conditions are almost identical and that the treatment's almost identical.
I met with the company that manufactures the
rods.
Yeah. But I guess it's probably the same company that, I don't know.
Well, that's a fantastic point. So you've just hit the nail on the head. So any company that manufactures a human device
would be the same for animals.
No, they're not willing to give the implants to animals because they don't make enough money.
Are you serious?
Yep.
So who makes the implants for...
We have to make them ourselves.
Gosh, that's ridiculous.
Exactly. So the sequence of events is the animal gets experimented on for, say, 6 months to a year.
Humans benefit, and then it doesn't go back to the animal, though.
Spot on.
I'd read a little bit and realised we start these experiments, we start with animals and then they go on to human beings, but the animals aren't even getting any benefit out of it, and they're just entitled as us to be cured if they can be. I think it's absolutely brilliant. I'm a dog lover anyway, I have a dog of my own, and I think any living creature has the right to be cured if they can be cured. And especially with something like this, I'm really quite shocked that these experiments start off with animals, we humans benefit from it, but then it's not shared back to the animals again, which is terribly unfair. It's awful.